I'm a urologist here at Urology Clinics of North Texas. My specialty is male infertility and sexual dysfunction. So we see men who are having difficulty conceiving, find out why, and then that will help us direct a treatment to ultimately help them become fathers. If men are having other issues related to sexual function, we do similar things to help them achieve their goals. A microTESE is the gold standard for treatment with men, what we call non-obstructive azoospermia. They just don't make sperm for some particular reason. However, the good news is, in those men, there's about a 60% chance that with this procedure, we can find a few sperm in their testicle, and those sperm can be used with a process called in vitro fertilization. The female partner is put on medication to make more eggs in a month than usual, and her eggs are extracted, as is the man's sperm, and then those are united in the lab, and that is how they get pregnant that way. And most men with non-obstructive azoospermia would be a candidate for a microTESE. However, if during the evaluation of that man's condition, you find a certain genetic condition where you know that the microTESE will invariably not find sperm, those men should not undergo the procedure. To prepare for a microTESE, your doctor may put you on medication for several months to maximize your chance of finding sperm. But otherwise, the preparation simply involves what would be required for anybody undergoing general anesthesia, stopping any blood thinners and making sure that you're healthy enough for general anesthesia, which most men at that age are. We'll have you not eat after midnight the night before. Coordination will also occur with the female partner's fertility lab to ensure that the timing of extracting the sperm is appropriate. When we do a microTESE, the patient is asleep because it can take a few hours. And once the patient is asleep and the area is prepped, we make an incision in the scrotum to gain access to the testicle. And then we make an incision in the testicle that allows us to see the contents within the testicle. We use an operating microscope to inspect those contents, looking for areas within the testicle where the tubules appear healthier, bigger, fatter around, like those might be some isolated areas of good sperm production. We sample those areas, place that tissue in a fluid where the sperm could live in all day, and we also concomitantly examine that fluid under a higher power microscope to see if we're actually finding sperm. Ultimately, that tissue is packaged up into vials of that special fluid and sent to the in vitro fertilization lab so that the eggs can be fertilized. The testicle and the scrotal skin are closed with absorbable suture, and the patient is awakened and goes home the same day. There is a chance that we don't find sperm, and so that is the biggest negative outcome that we concern ourselves with. There's also a possibility of some delayed bleeding in the scrotum where a hematoma or collection of blood can form. This is not harmful to your health, but uncomfortable. Chance of an infection after a microTESE is exceedingly low. It is common to have some pain after the procedure, however, and there is a small risk of some prolonged pain. We recommend that for the first few days after the procedure, you rest and ice the scrotal area intermittently throughout the day. We ask that patients not engage in sexual activity or physical exercise for 2 weeks. Most people can return to work after a few days unless they have an unusually strenuous and physically active job. Patients are sent home with a few days of antibiotics and pain medication to be taken as needed. After 2 to 3 weeks, we do encourage patients to resume sexual activity. There should be no change in erectile function, ability to climax. Those things should be unaffected. Is a microTESE covered by your insurance? That question is hard to answer definitively, but often it is not a covered benefit under most people's insurance plans, so it is a cash pay or out-of-pocket expense. Knowing that ahead of time, we have developed set prices with the surgery center and our anesthesia providers so that the patient knows what they will pay in advance, and we've kept that as low as possible. A microTESE is a specialized procedure that may not be performed very often by most urologists. These advanced microsurgical techniques have really helped men who want a family or want to add to their family have success, and urologists here at Urology Clinics of North Texas take pride in being able to participate in that process.